Rosemary.
Hello.
Hi, can you hear me?
Yes.
Oh,
Perfectly.
wonderful. Oh,
Wow.
wonderful.
Okay.
Okay.
Step one done. We can hear each other. Uh,
I know.
okay.
Oh my God.
Okay, Tiffany, whatever you prefer.
All right. Thanks, Rick. Good afternoon, everyone. My name is Tiffany Narvaez, and I'm part of the marketing team over at UnitedAg. Thank you so much for joining us today for this special presentation of Health Chats. Um, Before we get started, just a little bit of housekeeping. If you guys can just chat in your questions via the chat in feature, we will answer those questions at the end of the webinar. I've gone ahead and muted all of you guys, but please be sure to stay muted. Um, and yeah, if you have any other questions, you can chat them into me immediately in the chat feature or to everyone. But other than that, I will pass it on to Rick Tomlinson, President of California Strawberry Commission.
Thank you, Tiffany, and thank you to UnitedAg. We've been working with UnitedAg for many years, and in fact, participate in UnitedAg and have used UnitedAg for our health insurance at the Strawberry Commission for, gosh, probably over 15 years. And they've been just a really great partner to work with. And recently they offered to have these types of webinars to explain from a medical perspective what we might expect with COVID-19. And so today from UnitedAg is their Chief Medical Officer, Dr. Rosemary Koo, and I'll hand it over to you.
Great. Thank you so much, Rick. Hi, everyone. Thank you for joining me this afternoon. It's a pleasure to be able to talk with you. Over the last 4 weeks, we've seen a dramatic shift in the coronavirus outbreak. About 4 weeks ago, the US was still at less than 100 cases, and China was still the leader in the number of cases in the center of the outbreak. And then at the end of last week, we actually surpassed China number of cases. As of today, we're actually more than double the number of cases in China. So this is a situation that none of us have ever seen before. But what I'd like to do today is arm you with some facts of our latest understanding of the coronavirus or COVID situation. We'll also talk about COVID-19 and food safety. And I'll also give you my advice on how to prevent further spread in your workplace and how to keep yourselves and your employees safe and healthy. And at the end, we'll leave about half an hour for questions and answers. And so first of all, the virus name is SARS-CoV-2. And then the condition is actually COVID-19, which stands for the coronavirus disease. But you can obviously use the term coronavirus or COVID-19 or even just COVID interchangeably. As many of you know, this is a respiratory illness, and the key symptoms are fever, cough, and shortness of breath. Those are the symptoms that are mentioned most often on the CDC website, and the illness ranges from mild to severe. Since the very beginning, we've seen that at least 80 to 90% of people who get sick with COVID-19 actually only have a mild infection. So that remains true. But what we've learned over the last week or so is that not everyone has the stereotypical fever, cough, and shortness of breath. Some of the mild symptoms don't even come with fever, or it could look like a cold at first with really more of a runny nose and sore throat. People can get better after a few days, and then comes the fever and body aches. And then some even only have gastrointestinal symptoms in the beginning and don't even have the cough or respiratory symptoms in the very beginning. That's fairly rare, but there are case reports of this wide range of symptoms. So we have to be extra vigilant in case you feel unwell in any way. Person-to-person droplet transmission is still thought to be the dominant way that this virus spreads. And what that means is when you cough or sneeze, you actually send droplets into the air where the virus is, which then can land on someone else's mucous membranes of their nose or mouth, or it can land on objects. And then if someone touches those objects that has a live virus on it and then touches their face, they could get potentially infected that way. But person to person is still thought of as the most common mode of transmission. Over the last week or so, there's more data on how it could potentially be aerosolized. And that just means that the virus could be in smaller particles and travel through the air. Airborne transmission is something very different from droplet transmission. Airborne transmission is actually much more dangerous. But at this the WHO does not believe that airborne transmission is a common form of transmission for the virus, which is good news. The incubation period is around 5 days, and that just means the time from initial exposure to the virus to when symptoms show up. And then the range is 2 to 14 days, and that's why we recommend 14 days self-quarantine in case you have been exposed to the virus. Most people are the most contagious when they're actually actively having these symptoms. But there's recent data that shows that 1 out of 10 people who get sick with this virus actually got it from someone who wasn't showing symptoms at that time. So all of these factors kind of come together and make the virus very difficult to control, which is why it has a reproductive number notated here as R0, or more formally called R0, of 2.2. And what this reproductive number means is how many people can one person infect who's sick with the virus. And for the coronavirus, as the latest number is 2.2. Now, this is probably a conservative estimate. For every person who's sick with coronavirus, that person can infect 2.2 people. And this number can change over time. For reference, the R0 of flu is actually just 1.3. And even small increases in R0 can actually lead to dramatically different numbers in the amount of community spread a virus is able to achieve. And then lastly, the case fatality rate of coronavirus is at the most conservative estimates is at least 10 times more deadly than flu. And it's still much more deadly for people who are older or with chronic conditions. That doesn't mean that the young folks are immune, though, to serious complications. And in fact, 40% of people who get hospitalized are actually between the ages of between 20 and 54. So it's even the younger folks that can have symptoms that are so severe that they need hospitalization. I think as of yesterday or a few days ago, the FDA has granted emergency use authorization for hydroxychloroquine. So we do have an option for treatment for coronavirus cases, but those will typically, people who will get that as a treatment will be typically those who are hospitalized already. This is not a widespread authorization for use of this drug yet, and it's not meant to be preventative yet, although they're currently undergoing trials to see if hydroxychloroquine can prevent cases of coronavirus. And then there's currently no vaccine, but we're hoping to have one within about 12 months. Okay, the good news here is that there are no cases of spread of coronavirus through food or food packaging. And then the FDA has consistently and regularly stated that even if a worker gets sick with COVID-19, they do not anticipate having to recall the food or discard any of the food that that person may have been in contact with. Now, that could change over time, but as of right now, they do not anticipate any food recalls, even if an employee does get sick. And there are currently no recommendations beyond standard food safety and facility cleaning protocols. Now, the FDA does say that if there is a case of COVID-19 in the workplace, you might want to consider increasing the frequency of cleaning, but they have not been very prescriptive on their website at this point in time. While we don't anticipate that this virus can be spread through food or food packaging, that doesn't mean that it's impossible. And is because the virus can survive on surfaces. It can only survive in the air for a few hours, copper for a few hours, but it could survive on cardboard for about 24 hours and on plastics for up to 3 hours. So the potential for it to be spread through food packaging is there. We haven't seen that yet and hopefully won't see that. But that just makes it even more imperative to make sure that anyone who is sick in your facilities, if they're handling food or food packaging, to stay home, to make sure that there is minimal risk of that ever happening. And here we're going to switch into talking about prevention strategies for you individually and for the workplace. Now, you've all heard about social distancing, good hand hygiene, and staying home if you're sick. I'm not going to repeat really much of that because I think the CDC and many employers are repeating that. But what I do want to emphasize is that this has important implications for your workplace. I would take a very detailed assessment of how people interact in your workplace and what can you do structurally to make sure that they're staying 6 feet apart. Can you make sure that there are fewer chairs at a table? Can you put signs up in social gathering places? Please evaluate your crew sizes to see if they can maintain 6 feet of distance. If you can't currently maintain that with your current team structures and working protocols, a way to try to adjust that. And then on the self-isolation part, you have to be incredibly vigilant about sending people home, even if they're mildly symptomatic. And this is probably a good time to touch upon whether it's appropriate to do temperature or respiratory symptom screening before your employees to the workplace. I know there's been a lot of back and forth debate on it. And mind you, in some areas where there's a lot of community spread, like in Santa Clara or in Washington State, the local public health departments have told employers that they should screen for fever and symptoms, but it's not yet a widespread recommendation for all employers at this time. It could be, though, if the cases go up in number and we can't control the spread. But at this time, as employers, you don't necessarily have to check for fever or symptoms. And what I recommend instead is to help develop a culture where if any employee has any of those symptoms, to just not come in, to either call their supervisor. Don't wait for them to come into the office, have their supervisor observe symptoms, and then send them home. Try building a culture where the employees are very transparent about their symptoms and where they don't fear any retaliation in case they have to take time off for being mildly sick. Because as I mentioned, the symptoms could be quite broad, and for young, healthy people, the symptoms could be quite mild, but they could still be spreading the virus. Also, the testing for fever is for coronavirus. Although fever is a very common symptom of coronavirus, the initial studies in China showed that of the people who were hospitalized, only 45% of them had a fever when they were first brought to the hospital. Now, 80 to 90% of them did develop their hospitalization, but less than half of them had a fever on initial presentation. So fever may not be the best symptom, and it certainly is not a catch-all. And as you also already probably recognize, is that it's very easy to cover up fever through taking medications. And it's also easy to cover up cough through medications as well. So that's why I emphasize it's really important to build in that culture of transparency of symptoms, because even if you're screening for fever and symptoms, there are ways for employees to get around that if they feel like they have to hide those. Now, there's also a recommendation for general employees that if you've been exposed to anyone who tested positive for coronavirus, or if you've traveled to a hotspot, either domestically, such as New York, or internationally, that you have to self-quarantine for 14 days. Now, if it's travel related, most likely you still have to self-quarantine for 14 days. If it's exposure related to anyone in your workplace, so say an employee comes down with COVID-19, For most employers, the recommendation from the CDC is to still have the exposed employees stay home for 14 days and monitor for symptoms. But in food and agriculture, you're considered critical infrastructure. So you might have different rules. And while the FDA has not said that you can ignore the 14-day quarantine, it doesn't necessarily say that you absolutely have to follow it either right now. What they do say, though, is that if you have a case of COVID-19 in your workplace, you have to work with your local public health department to figure out next steps. And that local public health department will guide you on things like sanitation, facility closing, and whether or not the employees that were in close contact to the person who tested positive, whether or not they have to self-quarantine for 14 days. And so there's no blanket recommendation around self-quarantine after potential exposure in the workplace, but just be mindful that, that the recommendations can change depending on what the public health department says. And then they actually base those decisions on how much of community spread they're seeing in the geographical location at that time. So their recommendations could actually change day to day. And then lastly here is for you individually, the best prevention strategy that I can kind of advise you on is trying to optimize your own immune system. Because we don't have a preventive treatment in place, because we don't have a vaccine, your immune system is really the only barrier to stay safe during this time. And there are basically a few different recommendations I have for you for an immune system. First is that I do recommend you trying to get as, you know, kind of the daily required vitamins and minerals, and those are actually best absorbed from food. So yes, if you can't get food and you have multivitamins, go ahead and take your multivitamins. But this is the best time to start, you know, eating your fruits and veggies, whether that be fresh or frozen or in any form that you can really get to boost your availability of those vitamins and minerals and stay healthy. And then the second is also to still continue trying to get good sleep and minimize stress. And I know that's very difficult in this, a lot of uncertainty. But even under short periods of stress, there's data that shows that your immune system will drop significantly. And they actually learned this by studying medical students. So they would take blood samples in the days leading up to their final exams, and they could see that the immune cells that were necessary for fighting off viruses would actually decrease in number in the days leading up to their tests. So stress and sleep are major components to making sure that your immune system is functioning well. And then lastly, and this might sound a little bit more touchy-feely, but it's actually been proven to reduce anxiety and depression, is talking to people. You know, even though we might be isolated in distance from our peers, it's still really important to vent about to others and listen to others about their experience as well. There's actually scientific data that shows that if we as people do not do this, there are greater symptoms of anxiety and depression. So as much as you can, you know, try to boost your social networks during this time, reach out to people and support those around you. Because otherwise, you know, it helps everyone who's kind of involved in those communications. And I do want to make a point here about high-risk populations. If you or anyone in your household is older, 60, I know some organizations will use 65, but I've also seen 60. So I'm just going to say above age 60, or you have chronic medical conditions such as diabetes or any heart conditions or autoimmune conditions, or if you're immunocompromised in any way, or if you're pregnant, you might have a worse outcome from COVID-19 than other people who don't have these underlying conditions. You would actually be prioritized for testing typically, but to kind of prevent you from even getting sick from the first place, you should really be avoiding public. And that also includes trying to avoid going into any healthcare facilities if you can. And part of that is trying to get a 3-month supply of medications or delaying any routine visits if you don't have to see the doctor. I also recommend getting as much delivered to you, including groceries, medications, supplies, as possible so that you're not going into the stores. I mean, I think a lot of us have seen the state of affairs in the grocery stores and Costco today, and it's not pretty. Luckily, they're starting to kind of enforce social distancing within the grocery store, but it's a high density amount of people, and they're all touching all the items on the grocery shelves as well. And so if you can, avoid getting yourself into situations like that where there is a lot of heavy traffic. And then lastly, if you can, work from home. If you're in any of these high risk populations. And then for us in California, that's already kind of been recommended, is to work from home if that's possible. Now, if you do get sick, if you're not having emergent symptoms like shortness of breath, or very high fever that you can't control, if you can stay at home, you should stay at home. If you feel like you need health care for any reason, call your doctor first. Or if you are one of our members and have Teladoc, call Teladoc, and they can guide you through whether or not you can get tested. Now, I mentioned earlier that people with underlying chronic conditions or elderly or pregnant women prioritization and testing. The other group that is actually the highest priority list, even above those with chronic conditions, the number one priority for testing right now, patients and healthcare workers, so they don't spread the virus to all the patients that they see. And so given that there still might be is a test. And so if you have mild symptoms and you don't fall into any of those, high risk categories, you may not get tested, and they might just say that you should, take care of yourself at home. Now, with the surge of testing available, hopefully that'll change, because the more we can test in the US, the more we can find the cases, trace their contacts, and hopefully minimize spread. But until then, you can call the provider to see if you can get tested, but you might not be guaranteed to get a test. And if you have other people in your household, but you're the one who's sick, try to isolate yourself from the healthy people. That means stay in one room, and if you can, use your own bathroom so that the healthy people in your household aren't really exposed. And if you're the sick one, if you're going to be around other people, please wear a face mask. If you can't because of breathing issues or discomfort, then the other people around you should wear face masks if they're in your room or your bathroom. And much of the COVID-19 treatment is mostly supportive, which just means symptomatic treatment. And for you, if you're at home, that means over-the-counter medications such as Tylenol or ibuprofen, Mucinex for cough, things like that you can get over the counter. Now, about 2 weeks ago, there was a lot of controversy.
What happened?
Oh, hello.
30.
Thank you.
Sorry about that, guys. I muted that. Please be sure to stay muted, everyone.
That's okay. It's good to have a break. So now for over-the-counter medications, about 2 weeks ago, controversy over Tylenol versus ibuprofen. The WHO seemed to flip-flop on whether ibuprofen was harmful or COVID-19, and I think they finally settled on saying that it doesn't seem like ibuprofen is harmful for COVID-19. I don't know if this is going to sway back the other direction anytime soon, but regardless, usually healthcare providers will advise you to use Tylenol first to control fever or body aches, because ibuprofen can hurt the kidneys if it's in too high of a dose, or hurt your stomach if you can't eat enough. Ibuprofen should never be taken on an empty stomach, but Tylenol can. And if you're not feeling very well, most likely you're not eating very well. So go for the Tylenol first. If you need additional pain relief or fever relief, you should be able to the ibuprofen on top of that, as long as your doctor has not said otherwise. And as I mentioned before, if you do have to go into the healthcare system, please try to call ahead of time so that they can activate their own measures to protect their employees and also other patients. So that's about it for the content. We've included links up here for the wonderful Strawberry Commission's website on this. They have tons of resources on there for you, as well as the UnitedAg website has tons of resources as well. And so with that, we'd like to transition to the questions.
Thank you so much, Rosemary. And I just want to add to everyone, we've recently launched a new teleconsult service, our health and wellness centers. So our members can take advantage of that. It's $0 copay, 0 deductible for most plans. So you can find more information about that again on unitedag.org/coronavirus. But yes, please chat in your questions. We do have one really good question. If a person feels that they have had this prior to the severe outbreak, can they or should they get tested?
If that's assuming that you think you might have had it before, but now you don't have symptoms, you don't need to get tested. In fact, right now the CDC is saying anyone without symptoms really has the lowest priority for testing at this time.
Thank you. Any more questions? Will a PDF copy be provided of this webinar? Yes, we will actually provide a recording and a PDF of the presentation for you to share with your friends and family. Do UnitedAg clinics have the test? So our health and wellness centers, well, Rosemary, you can go ahead and answer that.
Oh, that's okay. I think we're going to say this, right? The same thing is that we do have the testing capabilities available. And then if you call in first to one of our health and wellness centers, they will triage you. As with any other healthcare facility, if you think you might have it or want to get tested, call first and they'll help you. But again, they are going to kind of follow the testing criteria that's set out by the CDC Public Health Department. So just so you know that just because you might want to test or feel like you are at high risk, care provider and the local public health department will coordinate the testing based on real-time criteria and availability of the tests.
And the next question, I feel like you just answered, does UnitedAg have resources to point individuals where they can get tested?
Yes.
It would be their healthcare provider.
Yes. Mm-hmm.
Any other questions? So just a heads up to everyone, we do these health chats every month. It's typically the third Friday of the month. If you guys are interested in joining us for any others, go to unitedag.org/health chats. Next month will be a very relevant topic, which is mental health and how coronavirus is affecting everyone. And I know that Dr. Koo touched on this. People are feeling very anxious and down. And so if you're interested in that, please sign up. We will have a link on our website today. So keep an eye out for that.
Dr. Koo and Tiffany, thank you so much. For those that are on the call, as Tiffany mentioned, this is being recorded, and so we'll have a copy of this on the Strawberry Commission website. I believe UnitedAg also has these webinars recorded available on their site. We also will have a Spanish version that UnitedAg conducted this past Friday. And so those resources will be available both on the Strawberry Commission website and UnitedAg.
Wonderful. Well, thank you so much, Rick, for having us here today. And thank you so much, Tiffany, for organizing all of this.
Of course. Thank you both. And thanks to everyone for joining us.